Hi guys, and welcome back to this video on Trucut Biopsy. Now Trucut Biopsy versus FNAC, this is what I want to tell you first. See, FNAC is a very easy process and the patient doesn't have much pain. We do not have to give local anesthetics or things like that because it is a pretty simple process. It is just a needle aspiration. Okay, लेकिन Trucut Biopsy, we're doing a biopsy over here. That's why you have to give anesthesia, है ना, तो you have to give a proper bandage, you have to maintain the hemostasis, so you have to take some precautions, and this is a little bit rigorous a process for the patient. But what I mean to say is that FNAC is cytology, but this is biopsy. So this is anything that you want to have a confirmatory information about, you have to do a biopsy. So obviously biopsy is superior to FNAC. ठीक है, तो whenever in FNAC you're not satisfied or you want a more proper diagnosis, then yes, you have to go for biopsy, and Trucut biopsy is basically the core biopsy. ठीक है, so this is a core biopsy which is taken with the help of gun, right? So we basically use automatic gun जहाँ पे एक ही switch, if you press one switch, then only that, I will show you the video, so that gets entered the needle, that machine, that opens up, it enters into the tissue, and then you take out the core, and that's it. So basically you can see that there are three kinds of basically instruments that you can use for this purpose: manual capture, semi-automatic, and automatic. So we basically use the automatic one, and there are different kinds of Trucut biopsy needles or instruments, but the one that we use, I will show you that in the video. So as you can see that you are just pressing a switch and the core is actually collected. The automatic, it happens, that's why it's called automatic, and then you take it out with the help of that same instrument, and by a needle you just take out the core and put it inside the formalin. So just a few basic points before I jump onto the video. So yes, it is a automatic instrument, automatic coaxial biopsy gun, which is designed to take the tissue cores with the help of a Trucut needle. Right now, obviously it is being prepared in a sterile manner, and a local anesthetic is given. The needle is inserted into the mass with or without guidance. Then the needle is clicked to open and cut out the tissue sample, take out the core and take out the imprints as well, and put the core in the formalin. That's it. You have to put a bandage and keep that for 24 hours at least, right? This is up the point regarding FNAC, which I have discussed in my previous video regarding the FNAC as well. The procedure involves taking 2 to 4 samples from each mass. So yes, like when we used to do like 2-3 PGTs used to do it, so everyone used to do it one time. So you can have cores, so you can have 3 to 4 cores, so 2 to 3 cores. So that's what you can do it, and then store in the formalin. And advantage is that yes, it is easy to use obviously, and it has a very high diagnostic rate, right? That is the implication of Trucut. It is better than FNAC if you are suspecting something serious, right? Now needle size is 14 to 18 gauge, right? So this is basically the guided Trucut. So guided can also be done like FNAC, but what I have seen mainly is by doing the blind procedure. Okay, so I'll just get away with the video very quickly. So please look at this image, that this is basically the Trucut gun that we are using. So you can see that there are basically two kind of switches that is there. So please see that I have first switched on, pressed one switch, and then the other switch. So this is the first one, okay, and then I will also kind of pull down the other part of that instrument. First prepare the patient using the anesthetic, and now just press the switch. Just press the switch. Yes, so okay, did you see it? Whenever the switch is being pressed, that these two whatever you have pressed down, that actually fires up, and when that fires up, that needle also enters inside the tissue, inside the mass, to get the cores. So just look at the switches that I've pressed. Just look at that once again. So as you can see that these two switches are basically, first they are down, right? So if I can just show you this. So just see this, that these two switches, right? This is one switch and this is another switch. Not switch, these are basically something that you can press down. ठीक है, तो पहले तो ये यहाँ पर था, ठीक है, तो but you have actually pressed this down and you also press this down. So press both of them down, and then this is the switch. ठीक है, दिस इज द मेन स्विच जो आप एक बार उसको आप क्लिक करोगे ऊपर की तरफ, उसको एक बार क्लिक करोगे तो ये दोनों जो कि है ये फायर हो जाएगा ऊपर की तरफ। ये दोनों के दोनों फर्स्ट यू आर पुटिंग देम डाउन, उसके बाद द मोमेंट यू आर गोइंग टू फायर दिस स्विच अप, ये दोनों के दोनों ही ऊपर की तरफ स्विच हो जाएगा एंड ये जो कोर है, ये जो नीडल है, ये अंदर की तरफ ऐसे घुस जाएगा। तो मान लो कि ये नीडल अभी तक यहाँ पर है, द मोमेंट यू प्रेस द स्विच इट विल फायर लाइक दिस एंड देन इट विल हैव द कोर ओवर हियर एंड देन यू टेक आउट दैट एंटायर नीडल एंड देन यू टेक आउट द कोर फ्रॉम दैट एरिया। ठीक है, तो इसको दिखाना थोड़ा बहुत मुश्किल होता है, एक सेकंड में ये दिख जाता है, दैट इज अ 1 सेकंड प्रोसेस। प्रिपरेशन में ही ज़्यादा टाइम लगता है उसको अच्छे से एक, ताकि ऐसे आपको यू हैव टू इंसर्ट इट दैट यू डू नॉट परफोरेट द अदर पार्ट ऑफ द मास, राइट? इफ द मास इज लाइक दिस एंड यू आर पुटिंग द नीडल लाइक दिस, you have to understand that once you fire it then that needle will actually extend up to this. ठीक है, so if you don't position it properly it may even puncture and come out of the other side because you're not able to see what's happening inside the tissue, inside the mass. So make sure that you place the gun in such a position that even after you're firing it should not cross the other boundary and perforate both the sides, then it will be a little bit डिजास्टर्स कंडीशन। ठीक है, ऐसा मतलब हुआ है, मैंने देखा हुआ है, इसलिए मैं कह रही हूँ कि ये प्रिकॉशंस लेते रहो। ठीक है, सो फर्स्ट यू प्रेस दिस 2 स्विचेस डाउन, ओके, प्रिपेयर इट कंप्लीटली एंड पोजिशन इट कंप्लीटली, देन यू प्रेस दिस स्विच, वंस यू प्रेस इट अप दिस एंटायर थिंग विल गो अप एंड नाउ द कोर विल ऑल्सो गेट फायर एंड देन यू टेक इट आउट। ओके, सो नाउ इफ यू सी द वीडियो इट विल मेक अ लिटिल मोर सेंस टू यू। सो प्लीज सी दैट बोथ द switches are down and the doctor is now ready to press this switch. Just look at this side that I've shown you. Okay, see, once you're pressing, see, okay, so the moment you're pressing these 2 switches have these 2 portions of the needle has come up, which means now the firing has been done. So just see this once again. Yes, so yeah, did you understand this? Just see this once again. Yeah, so just click it once and the entire thing will come up and that means that you have fired actually the needle or the gun. Okay, so just starting from the beginning, plus you have to first bring down these switches, both the switches you have to bring it down. That is how you're preparing the gun, both the switches completely, and then that is basically your gun getting prepared and you enter it into the tissue. And the moment you do that, first you give local anesthetic and then you prepare the tissue, the mass completely, and then you just, it's a one-time switch, just you press the switch and that gun will get fired and then you take it out slowly, okay, and then you are going to just bring out the needle with the help of that. Both the switches have to be pressed down to prepare this gun. Okay, so I hope that you have been able to understand this. This is nothing much to see, and then the moment you fire it, see, yes, did you see it? So this is what the demonstration is all about. Just pull them down and just fire it, and now you can see that you'll be able to see the core. That is it. I guess I had a hard time explaining this because it's a 1 second procedure, not able to appreciate much, but yes, it's a very important procedure. We do this day in and day out. It gives a lot of information as well. So I hope that you enjoyed watching this video and I will meet you very soon in the next video. So please subscribe my channel if you like my content and I will meet you in my next video. So thank you for watching.